After months of waiting, this is the moment that every mother looks forward to, the successful delivery of her new baby. Few expect their child to be immediately whisked away by specialist nurses without the chance to hold them first. Some parents don't even have the chance to see their babies before they're rushed off to intensive care or high dependency. The experience can be shocking and traumatic, but in fact it's not as unusual as you might think. 1 in 10 babies born in the UK spends some time in a neonatal unit.
You're going through what is meant to be a momentously sort of joyous occasion, giving birth to your baby, and it's all completely overwhelmed, I think, with this awful stress that you just don't know what's going on, and there's sort of 15 people in the room because there's the whole neonatal unit in the corner waiting to whisk your baby out.
It was really, a nightmare. I have to confess, it was a nightmare. I couldn't sleep properly, I couldn't eat properly, I couldn't talk. I was constantly crying. I'm really surprised now that I'm not crying. I really am, because it was really awful. It was a nightmare.
Babies may spend anything from a few days to many months in a neonatal unit. Some have an infection and need antibiotics. Some have breathing or feeding problems. Some need life-saving surgery. But the majority of babies who spend time in a neonatal unit are here because they were born too soon. In the last 20 years, the number of premature babies born in the UK has increased dramatically.
One of the important reasons why we're having more premature babies than in the past is that mothers are older when they're having their babies and may need assisted reproduction, so IVF, and they have an increased incidence of twins and multiple births who often arrive early.
So if you leave having babies till later, and I have absolutely nothing against that if they're cared for appropriately, I think that you are likely to have fewer babies, and you're likely to probably have a shorter gestation the older you are. But I think if you're cared for very closely, all that can be sorted out for you if you're an older mother. So you shouldn't put off all older mothers, really.
For parents, the whole environment of a neonatal intensive care or high dependency unit can be a huge shock. Many premature babies need to be in an incubator to control their body temperatures, as they're not able to do that for themselves until they're several weeks old. They may also need help with breathing, whether from a ventilator or CPAP. A ventilator drives air gently through a tube in the windpipe into the baby's lungs. CPAP stands for continuous positive airway pressure. This increases airflow through tubes inserted into the baby's nostrils and helps keep the lungs inflated. But very early babies will also need a lot of other support.
The main problem for babies who are very premature is with their breathing. In addition, it takes some time to establish feeding, so we usually have to give babies some glucose intravenously, and we may need to actually give babies nutrition through a vein. The other thing that little babies have trouble with is with temperature regulation, and that's why all the very premature babies are in incubators.
Babies can now survive from 23 weeks, although obviously the earlier they're born, the more help they'll need and the longer they're likely to be in hospital.
We usually tell the mums and dads that they can expect the baby to go home around about the time they were due to be born, and any time that they go home before that is a real bonus, but we try not to offer any false dates, or so they don't set their hearts on going home and not achieving that date, because that that can be a real disappointment. But a baby has to be feeding on their own and obviously putting on weight to go home and to be safe to go home as well.
But particularly in the first few days, most parents worry that their new baby could die.
Your main fear in the first few hours is whether the baby's going to survive or not, because they're so small and they're so vulnerable and their lungs aren't working properly, or hers weren't anyway. But the longer that they do go on, the more confident you become that they will make it.
You're dealing with all the stress and the guilt and the agony of, are they going to be okay? Are they going to survive? You know, every time I would come into hospital, you would be thinking, is he okay? Is he all right? Has he, you know, did he get through the night? Is something gone wrong with his breathing?
I was very frightened the first day after the initial shock of giving birth, and she was brought up to the neonatal unit. The nurses kept delaying my husband's and my visit to our initial visit, saying that she was having trouble, and I was very afraid then.
In fact, the majority of children who are born early will survive and thrive. For some, it can be a very long journey. It may seem as though you'll never get there, but it does happen. Even children born before 28 weeks learn to walk and talk and go on to lead completely normal lives.
Is that a big trap?
But with a new and extremely sick baby in a neonatal unit, families are suddenly faced with a situation over which they have little control. Parents have to put a huge amount of trust in the nursing and medical staff who are looking after their child.
You have to trust like the doctors and everything totally and what they say, you know. But I never used to ask very much because I was too scared to ask things. I didn't want to know anything.
Trust can be built in this situation on two levels. Firstly, to impress on families that we've got the professional skills and expertise to look after this baby in the best possible way. And at a human level, the fact that we are all on the same side of the fence here, trying to do what's best for that baby.
The sight of your child covered in wires inside an incubator is bound to be worrying and frightening, but many people find it helps once they understand what all the equipment is for.
For many babies born at less than 28 weeks gestation, this would be a very familiar setup that we would recognise certainly in this country. So this little baby is in an incubator where we're trying to provide heat, we're providing nutrition and ventilation support. The baby is intubated, so he has a little tube down his windpipe which is connected to a ventilation circuit. And the ventilator is here. There are many different types of ventilator, but as you can see, the baby is breathing on his own, but this is providing support and will provide support certainly in the early days and maybe weeks. There are lots of other lines monitoring the baby's physiology which are connected remotely to the monitor up here. So this is measuring very vital signs such as the heart rate, the breathing rate, the oxygen saturation and the blood pressure. So it means that we can observe the baby's condition hopefully without disturbing the baby too much.
Emotionally, the first few days or weeks may well be the worst. Apart from the shock, your child is probably at its most vulnerable, and many parents feel they're in some way to blame.
I was beating myself up about, you know, was I overworking? Had I been running around too much? Should I have been taking it easy? And you think, is this my fault? And the guilt that comes with that is enormous.
Heavy use of alcohol or drugs by mothers can affect a baby's weight and may be one reason why they're born early. But doctors say there's no evidence that a busy lifestyle causes premature birth.
While there may be a few instances where one can sort of pin down the premature baby to a particular lifestyle, mostly that's not the case. And I would say that mums really shouldn't be looking for causes or speculative causes or try and blame themselves. Often people will think it's something that they've eaten or, as you say, something they've done or haven't done. But that really would be unusual in my experience.
Nevertheless, parents have a strong desire to know why this has happened to them. In some cases, there is a clear explanation. Twins and triplets are very likely to be born prematurely.
I knew that with 3 babies, they would probably come early. And additional to that, in fact, Valentina was not growing very well. So they were monitored to see if Valentina was still growing. And by 33 weeks, the consultant decided that it was best to give birth to avoid risks for Valentina. So they were 7 weeks premature. Yeah.
Doctors may decide to deliver the baby early because of a medical emergency, the mother bleeding, high blood pressure, or a problem with the placenta or umbilical cord affecting the baby's growth. Around 1/3 of premature births are the result of preeclampsia. This only occurs in pregnancy. The first sign, usually sustained high blood pressure. It can be extremely dangerous for the mother, and if it becomes severe, the only solution is delivering the baby early. If for any reason the mother or baby are in danger, a caesarean section may be the safest option.
I was 24 weeks or so, and I was at work one day, and then the next day I wasn't feeling too well, so I went to the hospital just for a checkup. And they kept me in hospital and said, you have preeclampsia, just like that, basically. And they said that they would give me an emergency caesarean the next day. So I was in deep shock from that point, but luckily they kept me going. My doctor just kept me going until I was 27 weeks, and then my condition got very serious, and Samira they could see was not growing, and they decided to do an emergency caesarean on me.
But 1/3 of premature births occur for no apparent reason, adding to the confusion and guilt.
One of the things I found very difficult was people sending flowers or cards sort of in a congratulations type way, and I just felt like actually this feels wrong because I don't feel like I should be quite celebrating his birth. I'm just desperately concerned that he's going to survive.
I didn't want to imagine what would happen if I had lost him, or that there was a possibility of losing him because he had come so early. And it wasn't by any means just because he'd made it through certain stages, anything could happen at any point.
Stressful events like bereavement or moving house, even long-distance air travel can bring labour on prematurely. Sometimes your waters break early, which could be the result of infection, but the cause may never be known for sure. If the baby's under 35 weeks, the mother will probably be given drugs to delay labour and steroids to help the baby's lungs develop more quickly before they're born.
Really the biggest advance in treatment of women going into preterm labour is the use of antenatal steroids to help the baby's lungs mature. Okay? We know that they work and they improve the outcome quite considerably, but they do take 48 hours to work. And therefore the second drug that we can use is a drug to try and suppress the contractions, to try and stop the lady labouring.
There are 3 levels of care which a baby may need. The sickest and smallest babies who need the highest level of medical support will be looked after in intensive care. As babies progress, they'll be moved to high dependency. Those who still need some help breathing or who need to be fed intravenously can be cared for here. Babies needing the lowest level of support will be in special care or low dependency. They might have jaundice and need light therapy. They could need tube feeding or additional oxygen. It's also the final destination for babies who've been in hospital for several weeks or months and who are nearly ready to go home. Almost every baby in a neonatal unit will have their heart rate, breathing and oxygen levels monitored at some point. Each monitor is fitted with an alarm to warn staff of any problem. While some parents eventually get used to the alarms and even find them reassuring, others find them worrying. Sometimes staff don't seem to be responding quickly enough, but the alarms can be triggered simply by the baby making a sudden movement.
There are alarms going off even as we speak, but we need to be aware that a lot of these alarms are, if you like, false alarms. So the setup is very sensitive. And there's a lot of, if you like, background noise. So parents need to realise that just because an alarm goes off is not necessarily an emergency. It's more just a pointer for the nurse looking after the baby just to check something.
Although most of these babies are premature, not all of them are. Some babies born at term are admitted to the neonatal unit because they need specialist care or surgery.
I don't feel any difference between the prematures and mine, because before I did have, I think, 2 or 3. My baby's age, and since then, thank God, I think that they've moved or they're back home, but I really don't feel any difference at all. I mean, I feel quite fine, and in a way of being treated is the same level too. I mean, I'm happy.
When we first came down here, it was such an emergency, and I was so thinking about whether he was going to survive, I didn't really notice what the situation with the other children were. I've become much more aware now that being premature, they sort of know what they're doing, and it seems to be a series of events, and then they go home, even though it's a long time. Because Theo was very big and healthy, and there was no reason for him to be ill, it seemed much more frightening because no one really knew what was wrong with him.
Not all hospitals provide intensive care for newborns, and very few are equipped to perform surgery on premature babies, so some people will end up being